Hello everyone, I'm Swathi. I'm a yoga teacher. I've been associated with Arogya Physiotherapy for over 2 years now as a client of Dr. Pooja Tripathi. I am a yoga teacher, like I said. I work in this institute called Amrutha Bindu Yoga for over 4 years now, and I've specialized in yoga anatomy and prenatal yoga. So today we'll be learning a few yogasanas and a few yoga related movements for back pain, which is predominantly for lower back. For more such videos, do not forget to subscribe to Arogya Physiotherapy. Let's begin. Before we begin, I just want to say that these postures and these practices are generally good for back pain, but in case you have any other complications, it's good to consult a physiotherapist or a doctor. Alright, now come on all fours, on your knees and your hands. Now make sure that your wrist and shoulder are in one straight line, your knee and hip are in one straight line. Right? Now the first practice, the first movement we are going to do is cat and cow. Right? Now inhale, lift your chest, lift the hip up, look up. Exhale, round your back. Inhale, arch the back. As much as you can, keep pushing your hip and your chest and look up. Exhale, round the back. Now here, take your chest and abdomen as close as possible, pushing away from the floor. Inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. Alright, for the next one, we will be doing hip rotation in this posture. Alright, so now inhale, stay, exhale, move your hip to the right, back, left and forward. Right, back, left, forward. Right? Now as you exhale, you take the hip back, and as you inhale, you come forward. Now let's repeat this. Go ahead. Exhale, back, inhale, exhale, inhale. Now here, make sure not to move your shoulder. Alright, you're not moving the shoulder. It's only the hip that's moving. 5 more rounds. Inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, last one, exhale, center. Now reverse. Center. Now push the hip back, bend forward, child's pose or Shashankasana. Here you can either keep your toes together, knees apart and bend, or you can also keep your knees together and bend. Now for the next one, we stand up. Alright, so now for the next couple of postures, we'll be using a chair. You can take any chair that you have around, preferably not the chair that wheels down, right? So a chair which is stable. And yeah, let's go. So the first posture is a side bend, for which keep the chair in this position next to you and the backrest closer to you. Place your right hand on the chair. Keep your feet about a hip width apart. Lift your left arm up. Exhale and bend sideways. Now when you're bending sideways, if your elbow is bending too much, then go slightly away from the chair And make sure you are not bending at the hip, you are not doing this. Hip is stable, hip and ankle stable, you are only bending with your upper body. So you can turn and look down if you are not able to keep your head this way, you can turn and look down or look up. Hold for about 10 breaths here. Remember not to drop your chest, chest lifted and bent. Now inhale, center, release, exhale. Now to the other side. Inhale, lift your arms up, move slightly away from the chair, exhale and bend sideways. Again, hold here for 10 minutes. Keep pushing the chest away. See, the other one mistake to avoid here is dropping the chest. Here we feel like we are going sideways, but we are not going sideways here. See the chest? Forward, up and bend. Right? Inhale and come up. Release, exhale. The next posture, turn the chair towards you. Now again, feet about a hip width apart. Hip width is the width under the hip bone, right? Now, as you exhale, keep your knees gently bent, bend forward. Now look at my back. Back is straight, right? Now drop your forearms down and the forehead down on the chair. Now remember here, you can keep your knees bent, but make sure your back is not curving. So one common mistake here is to keep the knees straight and bent. Now my back is completely rounded, and when I do this, the weight and strain comes on the lower back, which defeats the purpose, right? So keep the knees bent, keep your back straight, hip lifted and bend forward. Now stay here for about 10 to 15 breaths. Lengthening the back. Keep your knees comfortably bent. If you have to bend so much, also that's okay, but make sure your knees don't cross the ankles, right? Push the hip back and that's it. Any forward bend done this way, where we keep the back straight, lengthens and releases any strain from the lower back. Right? Now inhale and slowly come up. Now for the next posture. Come onto your chest. Lie down on your chest. Comfortably. Right? Rest your abdomen here for a bit. Now inhale, drop your forearms down. Palms down, feet together, toes pointing back. Tuck your hip in, keep pushing the hip down. Right? Keep your legs tight. Press the thighs together and press the top of the feet down on the mat. Push the hip forward and lift your chest up. One common mistake to avoid here is doing this. Lifting the shoulders and dropping the chest and staying here, right? This is not doing any good. So keep your shoulders back and lift your chest up. Make space between your ears and shoulders as much as possible while you also push your pelvis down into the mat. Keep your buttocks squeezed gently. Lift your chest and breathe. Again, hold for about 10 breaths here. This is an amazing posture to strengthen the lower back. And in this posture, in case your pain increases, avoid this posture or just stay for about 3 to 5 breaths and release. Now exhale, slowly. Come down, drop down. Hands next to the chest. Come on, inhale. Back to Shashankasana or child's pose. Inhale and rise. Now for the next posture, we'll do Baddha Kona or the butterfly pose. Now here, bring the soles of your feet together, interlock your fingers around your toes. Now here, make sure that you are not sitting on the flesh of your buttocks. Lift the flesh off and sit on the two pokey bones, okay, of the hip. Now gently start to flap your thighs. This will release any strain and tension around your lower back area and the hip area. You can do this for about 30 to 40 seconds. Now slow down. Now I'll just shift the other side. Now in the same posture, you're sitting in Baddha Kona. Drop your fingertips down. Keep your back straight and keep moving your fingertips forward. Now here what to avoid is this. No rounding the back, no rounding the shoulder. Keep your chest lifted away from the abdomen, shoulders relaxed. Again, remember what we discussed regarding a forward bend. Keep your back straight and bend forward only as much as you can, as long as your back is straight. Stay here. You can either drop your hands or the fingertips down. Stay here for about 10 breaths. Now here, if you can go further down, stretch your arms further forward, drop your forearms down and drop the forehead down. Here make sure you're moving your chest forward and down and not your forehead without rounding the back too much. Okay? Keep your back lengthened as much as you can. Now inhale and slowly come up. Closer, switch your legs forward. Now for the next posture, we'll do a gentle twist. Sit in Sukhasana or any cross-legged posture. Take your right hand outside the left knee, left hand behind, just behind the back. Press the entire palm down, lift your chest and twist. Now when you're twisting, it's not just the head that you twist, it's the shoulder. Right? The entire shoulder and chest area opens up to the side. Once you're comfortable here, you can turn and look back, or you can keep your head in line with your chest. Keep pushing away from the floor. Abdomen pulled in and up. Don't do this. Again, chest away, abdomen engaged. And open the chest. Now switch the other side. Pushing away, no leaning on the shoulder, push away, lift your chest and open it out to the other side. Exhale, release. Now for the last posture, lie down on the back. Setu Bandhasana. Bring your heels close to the buttocks, hands next to the hip. Squeeze your buttocks slightly. Lift your pelvis up. Alright. Now don't lift your hip with your pelvis tilted out or the hip moving downward. Lift the hip up with the entire hip area lifted and then lift the entire buttocks off the floor. This is a wonderful posture to strengthen your lower back and the hip region. Press your feet down firmly and keep lifting the hip up. Exhale and slowly release. Alright, now we'll move to relaxation. Now hug your knees to the chest, arms stretch sideways, take your knees towards the right elbow, head turn to the left. Close your eyes, relax here. Don't keep your feet off the floor here, feet down, body relaxed, shoulders relaxed. Right? In case you're not able to take your knees all the way down, that's perfectly alright. Just stay wherever you're comfortable. Now inhale center, exhale, knees to the left elbow, head down to the right. Just stretch your legs out. Do everyone's favorite posture, Shavasana. You can stay here for about 15 to 20 breaths. Also, in case you have a sore lower back, I would prefer if you could bend your knees and lie down so that the entire back is rested well on the floor. Alright, that's a quick practice to strengthen and release any tension from your lower back. Like I mentioned in the beginning, in case you are finding it difficult to manage your pain, do consult a physiotherapist or an orthopedician who can help you diagnose the pain and give you better results. Right? This is a general practice for general lower back stiffness and pain. I hope you like the practice. And in case you would like to have personal sessions with me, you can contact me. Details will be given below in the description. Thank you so much.